Welcome to Bookish Mind, Season 3, Episode 11. Today we explore how our emotional lives are not just mental landscapes, but powerful forces that shape our physical health. For this deep dive, we're taking a look at some really compelling research and real-world examples, all drawn from a single insightful source. Our mission is to really understand the powerful, often underestimated connection between our emotional states and our physical well-being, highlighting just how deeply intertwined our minds and bodies truly are.
And that's exactly what we're going to unpack. We'll explore how science is now, more than ever, confirming what many have intuitively suspected for a long time, that emotions aren't just abstract feelings. They have tangible physiological impacts on our bodies. Our goal today is to clarify what's genuinely supported by robust data versus, some of the common misconceptions out there. It's about separating the signal from the noise when it comes to the mind-body connection.
Okay, so to start, our source opens with a really compelling personal story. It brings this connection to life almost immediately. Imagine this: a routine doctor's visit for, like, a vague ache. Then the doctor mentions traces of blood in the urine and the need for tests, including something called cytology.
Right.
For the author, the word cytology instantly triggered thoughts of cancer. Just like that, their world narrowed. An overwhelming feeling of fear and vulnerability just washed over them, leading to a complete mental freeze. They describe being unable to process even simple instructions.
That's intense.
It really is. And it's a powerful illustration of how quickly and intensely illness can shatter our illusion of invulnerability, leaving us feeling, well, fragile and helpless.
Yeah, and that experience really highlights a significant blind spot in traditional modern medicine. For a long time, the focus has been almost exclusively on curing disease, treating the medical disorder itself, while often neglecting the patient's experience of disease.
You mean the emotional side of things?
Exactly. The profound emotional reality that accompanies illness, patients, and even the medical model itself have often sort of quietly agreed to dismiss these emotional reactions as somehow irrelevant to the physical condition.
Which seems crazy now, looking back, and this is where the science began to shift, right? Our source points to a pivotal moment back in 1974 with the groundbreaking work of Robert Ader at the University of Rochester.
Ader, yes. He made a really surprising discovery. The immune system, like the brain, could learn.
Learn. How does an immune system learn?
Well, in his experiment with white rats, he gave them a medication that suppressed T-cell counts, along with saccharinized water. Standard conditioning stuff initially. But then crucially, he found that giving the rats just the saccharin-flavored water without the medication still led to a drop in their T-cell count. Some rats even got sick and died from this learned response.
Wow. So their immune system learned to suppress itself just from the taste.
Pretty much. Their immune system had actually learned to weaken itself in response to the flavored water alone. And that completely defied centuries of medical belief that the brain and immune system operated as totally separate entities.
So if they were thought to be separate, how could that even happen?
Exactly. Ader's work forced a complete reevaluation of those supposed boundaries. This led to the birth of an entirely new field, psychoneuroimmunology, or PNI.
PNI. Okay, break that down.
Sure. The name itself reveals the connection. Psycho for the mind, neuro for the nervous system and hormones, and immunology for the immune system. It clearly highlights this intricate, interconnected web.
Okay, so the name itself points to the connections, and the research since then has really mapped out the direct physical pathways, hasn't it? Like David Felton's work, a colleague of Ader's, I think.
That's right. Felton observed that emotions strongly affect the autonomic nervous system, the part that controls involuntary functions like heart rate, digestion, that kind of thing. Felton and his team then discovered actual synapse-like contacts, where nerve terminals of this autonomic nervous system directly meet immune cells, like lymphocytes and macrophages.
Wait, nerve endings touching immune cells?
Directly. It means nerves can release neurotransmitters, those chemical messengers, right onto the immune cells to regulate them. That was revolutionary because, well, nobody suspected immune cells could be directly targeted by nerve messages like that.
So how did they prove it wasn't just a coincidence?
Well, Felton did another experiment. He removed these specific nerve endings in animals and then exposed their immune systems to viruses. The result? A huge drop in the immune response. Clear evidence that the nervous system isn't just connected, it's actually essential for proper immune function.
That's incredible. And it's not just nerves, right? Hormones play a role too.
Absolutely. Stress hormones like epinephrine, norepinephrine, cortisol, the ones that surge during stress arousal, they also have a significant impact. While the relationships are complex, the main effect seems to be that these hormones can temporarily suppress immune resistance.
Okay, so the science is building a strong case. But you mentioned earlier that many doctors were, maybe still are, skeptical.
That's true. Despite all this growing scientific evidence, it's fair to say many physicians have remained skeptical about the clinical significance. It's often been difficult to pinpoint if these physiological changes are, significant enough to make a measurable medical difference in day-to-day practice.
But there is counter evidence, right? From doctors themselves.
Oh, definitely. And it's incredibly compelling. Take Dr. Kamran Nezhat, an eminent gynecological surgeon at Stanford. He explicitly states that if a patient's schedule for surgery is panicked, he cancels it.
He cancels the surgery. Why?
His reasoning. He explains, and I'm quoting roughly here, every surgeon knows that people who are extremely scared do terribly in surgery. They bleed too much, have more infections and complications, they have a harder time recovering. That's a direct link he's making between anxiety and surgical outcomes, often due to things like high blood pressure.
That's a powerful observation straight from the operating room. What about larger studies? Is there bigger data?
There is. Our source highlights a huge analysis, a combination of 101 studies involving thousands of men and women. And the findings are quite stark. People who experienced chronic negative emotions, things like anxiety, long periods of sadness, pessimism, unremitting tension, incessant hostility, relentless cynicism, or suspiciousness.
So basically being stuck in a negative state long term.
Exactly. Those people were found to have double the risk of diseases like asthma, arthritis, headaches, peptic ulcers, and, crucially, heart disease.
Double the risk. That's significant.
It really is. The source emphasizes that this makes these chronic negative emotions as toxic a risk factor as, say, smoking or high cholesterol for heart disease. Think about that for a moment. We often focus so much on diet and exercise, but these findings suggest our emotional habits might be just as critical, maybe even more so, for our long-term health.
Let's dig into anger specifically. Our source mentions its lethal power. There's a Stanford study.
Yes, a fascinating one. They looked at heart patients, recalling incidents that made them angry. As they simply recounted these moments, the pumping efficiency of their hearts dropped by 5 percentage points.
Just from remembering.
Just from remembering. And for some, this drop reached levels considered a sign of myocardial ischemia. That's a dangerous reduction in blood flow to the heart muscle itself.
And didn't the source say they weren't even that angry when remembering?
Exactly. That's the kicker. The patients reported being only half as mad as they had been during the actual event. It suggests the real-time impact would have been even greater. And interestingly, this drop wasn't seen with other distressing feelings like anxiety, just anger.
So it's specifically anger doing this, and this connects to the old type A idea, doesn't it? Or does it?
Well, it refined that idea. The research showed the broader type A personality theory didn't quite hold up under scrutiny. But what did emerge as the real risk factor was hostility, a specific kind of anger.
Hostility, okay. What's the evidence for that?
Dr. Redford Williams at Duke University did extensive research here. He found, for example, that physicians who scored high on hostility tests in medical school were an astonishing 7 times as likely to have died by age 50 compared to those with low scores.
7 times. That's huge. More than smoking.
According to that study, yes. It made hostility a stronger predictor than smoking, high blood pressure, and high cholesterol. And his colleague, Dr. John Barefoot, also found that hostility scores correlate directly with the extent and severity of coronary artery disease in heart patients.
Okay, so how does hostility physically damage the heart over time? What's the mechanism?
It seems pretty clear. Repeated episodes of anger and hostility increase heart rate and blood pressure. Over time, this causes tiny microtears in the lining of blood vessels, especially the coronary arteries. These microtears are like rough patches where plaque, that fatty deposit, can easily build up. This accelerates heart disease over decades.
Right, the plaque buildup. And I assume this is even worse if you already have heart disease.
Much worse. Anger and hostility can be particularly lethal then. Multiple studies, Stanford, Yale. They consistently show that hostile individuals, especially men, and those easily provoked to anger, face a significantly higher risk of having a second heart attack or dying from cardiac arrest.
Is there a time frame? Like, how quickly can anger trigger something?
One Harvard study was quite specific. It showed that an episode of anger more than doubled the risk of cardiac arrest for people who already had heart disease, and this heightened risk actually lasted for about 2 hours after the anger flared up.
2 hours? Wow. So, given all this, what can people do to suppress the anger?
Actually, no. The research clarifies that just bottling it up isn't the answer. Suppressing anger can sometimes even magnify the body's physical agitation. The key seems to be addressing the underlying chronic hostility.
So changing the pattern, not just the single outburst. How?
Programs like those at Stanford and developed by Dr. Williams focus on teaching basic elements of emotional intelligence. Things like becoming mindful of anger as it starts to stir, recognizing the cynical thoughts that fuel it, and then using regulation techniques like mentally telling yourself, stop.
Okay.
They also encourage actively substituting more benign, trusting thoughts for the cynical ones, and crucially, developing empathy. Dr. Williams puts it nicely, the antidote to hostility is to develop a more trusting heart. Apparently, when people truly grasp that their hostility could literally lead to an early grave, they become much more motivated to change.
Makes sense. Okay, beyond specific hostility, what about just general stress and anxiety, the kind many of us feel daily?
That's equally significant, absolutely. The source characterizes a lot of modern anxiety as out of proportion and out of place, often conjured by our minds rather than responding to real, immediate dangers.
And the physical effects are widespread.
Hugely widespread. Yale psychologist Bruce McEwen did a major review back in '93, detailing a broad spectrum of negative effects from chronic stress. It can compromise immune function, potentially speeding up cancer metastasis, increase vulnerability to viral infections, worsen plaque formation in arteries leading to heart attacks, accelerate the onset of diabetes, aggravate asthma, contribute to ulcers.
It sounds like it affects almost everything.
Pretty much. It can even damage the hippocampus, a key brain area for memory. McEwen described it as immense wear and tear on the entire nervous system.
Is there direct proof stress weakens the immune system, like in a controlled experiment?
Oh, yes. Sheldon Cohen's cold virus study at Carnegie Mellon is considered a landmark. He assessed people's stress levels, then deliberately exposed them to a common cold virus. The results were clear. The higher their stress level, the more likely they were to actually catch the cold.
What were the numbers?
Among the most stressed group, 47% caught the cold, compared to only 27% of the least stressed group. That's direct, rigorous evidence that stress lowers our defenses.
And we see this play out in everyday life too, right?
Definitely. The source mentions things like married couples reporting more daily hassles, being more prone to colds or upper respiratory infections, or the herpes virus, which many people carry latently reactivating during stressful periods like exams, separation, or caring for a sick relative. Stress gives the virus an opportunity.
And cardiovascular effects. You mentioned heart attacks earlier.
Yes, and for women, particularly after a heart attack, anxiety and fear might be even more deadly than for men. It can sometimes lead to crippling phobias that really restrict their lives. Even on a micro level, one study showed anxiety increased levels of ATP in the blood, something linked to vessel changes that can trigger heart attacks, alongside raising heart rate and blood pressure.
What about stress from work? Job strain.
That's a big one, too. High-pressure jobs where you have little control, the classic examples of bus driver, are linked to higher rates of hypertension. And, perhaps surprisingly, one study found that workers reporting severe on-the-job aggravation had a 5.5 times higher risk of colorectal cancer.
Wow, 5.5 times. That's significant. So, given all these negative impacts of stress and anxiety, what's the countermeasure?
Well, logically, relaxation. Techniques that directly counter the physiological arousal of stress, things like meditation, deep breathing, progressive muscle relaxation, are proving clinically beneficial for a whole range of chronic illnesses linked to stress.
Okay, so we've covered anger, hostility, stress, anxiety. What about depression? That seems like another major emotion burden.
It absolutely is.
Yeah.
And the medical costs of depression are profound, but often overlooked. A major issue is that depression is frequently misdiagnosed or simply goes untreated in medical patients. Its symptoms like fatigue, loss of appetite, sleep problems can easily be mistaken for symptoms of the physical illness itself.
So doctors might miss it, thinking it's just part of the other disease.
Exactly. But this failure to diagnose and treat the depression can severely impede recovery from the physical illness and, tragically, heighten the risk of death.
Can you give some examples of that?
The source cites some really sobering statistics. In a study of bone marrow transplant patients, 12 out of 13 patients who were depressed died within a year. Compare that to the non-depressed group, where 34 out of 87 were still alive after 2 years. A massive difference.
That's incredibly stark. Any others?
Yes. For patients on dialysis for chronic kidney failure, depression was found to be a stronger predictor of death than any of their physical medical signs.
Stronger than the medical factors. Why?
Often because depression led to noncompliance. Patients just wouldn't or couldn't stick to their demanding treatment regimens. There are links to heart disease, too. Severely depressed middle-aged individuals had a 4 times greater death rate from heart disease.
4 times, and after a heart attack.
Even more dramatic, heart attack survivors who were seriously depressed had a 5 times higher death rate within the following 6 months. That effect size is as great as major physical risk factors like previous heart attacks or severe damage to the heart muscle.
5 times. And it affects recovery in other areas too, like surgery.
Yes. A study on elderly women recovering from hip fractures found that the depressed women stayed in the hospital an average of 8 days longer and were less likely to be able to walk independently upon discharge. But, and this is key, those who received psychiatric help for their depression recovered better and had fewer rehospitalizations later on.
So treating the depression directly helps the physical recovery.
Absolutely. And for patients juggling multiple illnesses, treating their coexisting depression significantly reduced their number of disabled days per year in one study, from 79 days down to 51 for those with major depression. The evidence is just overwhelming. Attending to depression in medical patients isn't just nice, it can save lives and dramatically improve recovery.
Okay, so we spent a lot of time on the toxic emotions. Let's shift gears. What about positive emotions? Can they actually heal?
That's the hopeful side of the coin. The source suggests positive emotions can indeed have a measurable tonic effect. Now, it's important to clarify, they are not presented as some kind of cure-all. You can't just think happy thoughts and make a serious disease vanish. But they do seem to offer subtle, yet significant, beneficial impacts that can be teased out in large-scale studies.
Okay, subtle but measurable, like optimism. Does being optimistic actually make a difference in, say, heart attack survival?
Apparently, yes.
Yeah.
In that study of 122 men after their first heart attack we touched on earlier, optimism turned out to be a better predictor of survival over the next 8 years than any standard medical risk factor, like the severity of the heart attack itself.
Better than the medical factors, really?
That's what the study found. Of the 25 most pessimistic men, 21 died within those 8 years. But among the 25 most optimistic men, only 6 died.
That difference is huge.
It is. And similar findings pop up elsewhere. Optimistic patients undergoing bypass surgery tended to have faster recoveries and fewer post-surgical complications. Even in a different context, like recovery from spinal cord injuries, patients with higher levels of hope achieved greater physical mobility later on.
Why? Do we know how optimism helps? Is it just that optimistic people take better care of themselves?
That's one theoryless self-neglect. Optimists might be less likely to smoke, drink heavily, more likely to exercise and follow medical advice, but there's also speculation about a direct biological benefit, maybe through the immune system or hormonal balance, though that's harder to pin down definitively.
Okay, so individual outlook matters. What about our connections with other people? Social support.
This is another area with incredibly powerful findings. The medical value of relationships and social support is profound. Decades of research involving literally tens of thousands of people have converged on a startling finding. Social isolation, that subjective sense of having nobody you can really confide in or depend on, doubles your chances of getting sick or dying.
Doubles. Compared to what?
Compared to people who feel connected. The source states this makes social isolation as significant to mortality rates as smoking, high blood pressure, high cholesterol, obesity, and lack of physical exercise.
As significant as smoking or high cholesterol.
Wow. Even more so, according to the numbers cited. Smoking was linked to a 1.6 times increase in mortality risk, while social isolation was linked to a 2.0 times increase. So, arguably, being isolated is a greater health risk than smoking.
That's honestly staggering. I had no idea it was that dramatic. Does it affect everyone equally?
Interestingly, the risk seems higher for men. Isolated men were found to be 2 to 3 times more likely to die than men with strong social ties. The gap wasn't as large for women.
Any idea why?
The speculation is that women's relationships, on average, tend to be more emotionally intimate, providing more of that crucial confiding support. And it's really important to stress, isolation here isn't about liking solitude. It's the subjective feeling of being cut off, lacking connection, even if you're surrounded by people.
That subjective feeling.
Yeah.
Which feels very relevant today with, maybe less community connection, more screen time.
Exactly. Modern societal trends could potentially be contributing to this sense of isolation for more people.
Can we see this protective effect in specific medical situations?
Yes.
Yeah.
Remember the bone marrow transplant study? Patients who reported having strong emotional support from spouses, family, or friends had a 54% survival rate after 2 years. Compare that to only 20% survival for those who felt they had little support. Same medical condition, vastly different outcomes based on connection.
54 versus 20%, just based on support.
But perhaps the most telling evidence comes from a big study in Göteborg, Sweden, following men over time. They found, as expected, that men reporting high levels of emotional stress had a 3 times greater death rate overall. But,
There's a but.
a huge but, for the men who also reported having a dependable web of intimacy, a close relationship with a wife, good friends they could rely on, there was no relationship whatsoever between their high stress levels and their death rate.
Wait, so the support completely neutralized the lethal effect of the stress?
That's exactly what it suggests. Having people to turn to talk with, acted as a powerful buffer, a protective factor against the deadly impact of life's hardships. It also highlights that quality matters. It's not just having relationships, bad relationships. Constant arguments, feeling disliked by people you live with can actually harm the immune system.
So good connections protect, bad connections harm. It makes intuitive sense. And this links to the idea of just talking about things, right? Unburdening yourself.
Precisely. There's wisdom in that old saying the source quotes from Robin Hood. A flow of words doth ever ease the heart of sorrows. Psychologist James Pennebaker did fascinating experiments on this. He had people simply write about their deepest feelings regarding traumatic experiences for just 15-20 minutes a day for a few days.
It's just writing. What happened?
The results were quite striking. They showed enhanced immune function, significant drops in health center visits, and in one study, even improved liver function markers compared to control groups who wrote about trivial topics.
Wow. Was there a particular way of writing that helped most?
Yes, the healthiest patterns seemed to be initially expressing the turbulent negative feelings, but then, over subsequent writing sessions, starting to construct a narrative, finding some meaning or understanding in the experience.
Finding meaning. That sounds a lot like what happens in therapy.
Exactly. Pennebaker's work provides a compelling link, suggesting why psychotherapy can be so beneficial for medical patients. It facilitates that process of emotional processing and finding meaning. But perhaps the most powerful demonstration of this comes from Dr. David Spiegel's Stanford breast cancer study. This one is truly remarkable.
Okay, tell me about it.
He took women with advanced metastatic breast cancer, meaning their cancer had returned and spread, a very serious prognosis. They all received the standard medical care available at the time. But half of the women were also assigned to attend a weekly support group focused on emotional expression, coping strategies, and mutual support.
Okay, standard care versus standard care plus a support group. What was the outcome?
The outcome was stunning. The women who attended the weekly support groups lived, on average, twice as long as the women who only received standard medical care.
Twice as long. How much longer was that?
An average of 37 additional months for the support group women compared to 19 months for the control group. Almost 2 extra years of life.
From a support group, not a new drug.
Exactly. From a support group, alongside the same medical treatment. The source makes the powerful point. If it had been a new drug that produced the extended life expectancy, pharmaceutical companies would be battling to produce it.
That puts it into perspective. It really underscores the profound impact of emotional connection and support on physical survival.
It really does. And thinking back to the author's personal story that started us off, leaving the doctor's office full of fear and unanswered questions, that's sadly not unique. One study found patients typically have about 3 questions in mind for their doctor, but only manage to get about 1.5 answered on average.
Only half their questions.
Right. And that unmet need for information and reassurance fuels uncertainty, fear, and, as we discussed with depression, can even lead to non-compliance with treatment. It shows how often the patient's psychological journey gets overlooked.
So, pulling all this together, what does it mean for actually changing medical care? How can we make medicine more emotionally intelligent?
Our source suggests several practical steps. It really starts with patient empowerment, giving patients better access to medical information so they can be equal partners in their care, not just passive recipients.
Makes sense. What else?
Simple programs that teach patients how to ask effective questions during their brief appointments can make a big difference in getting those answers. For hospitals, offering pre-surgery preparation that includes relaxation techniques and clear explanations of what to expect has been shown to help patients recover an average of 2 to 3 days sooner.
2 or 3 days sooner just from better prep. That's significant.
It is. Even hospital design plays a role, making it easier for family members to stay overnight and be involved in care provides crucial emotional support.
And relaxation training itself.
Absolutely critical.
Yeah.
John Kabat-Zinn's pioneering stress reduction clinic, using mindfulness meditation and yoga, shows how powerful deep relaxation can be as part of managing chronic illness and pain. And Dr. Dean Ornish's program for heart disease famously showed that comprehensive lifestyle changes, including crucial stress management and relaxation training, could actually reverse the buildup of artery-clogging plaque.
Reversing heart disease, relaxation was key to that.
It was a core component, directly countering the physiological damage caused by stress. Ultimately, all this points towards fostering a relationship-centered care. Care where physicians, nurses, the whole team are attuned to the patient's emotional state, where they truly listen and where they can be heard. This strongly suggests a need for more emotional intelligence training within medical education itself.
Okay, so if we embrace this idea of a medicine that truly cares, what are the big implications? What are the main takeaways?
The source points to two really large implications. First, disease prevention. Helping people learn to better manage their upsetting feelings. Chronic anger, anxiety, depression, pessimism, loneliness should be seen as a form of disease prevention.
On par with things like quitting smoking.
Yes. Given the data on the toxicity of these chronic negative states, the potential medical payoff is argued to be just as significant as major public health campaigns like anti-smoking efforts. This suggests we should be targeting interventions, teaching basic emotional intelligence skills early on to children to establish lifelong habits, offering support for people nearing retirement or facing major life changes, and especially providing resources for populations living under extraordinary chronic stress.
Okay, prevention is one. What's the second implication?
The second is the measurable patient benefit of attending to psychological needs alongside medical ones. It's clear now that patients do benefit significantly in terms of recovery, survival rates, quality of life, when their emotional distress is acknowledged and addressed as part of their overall care.
And this isn't just about being nicer, is it? There are tangible benefits for the healthcare system, too.
Exactly. This isn't just soft stuff. There's a clear business case emerging. Early evidence suggests that treating emotional distress effectively can actually save money. Remember the hip fracture study. Treating depression in those elderly women led to shorter hospital stays and fewer readmissions, resulting in estimated savings of nearly $100,000 in that specific study group. Plus, in an increasingly competitive healthcare market, providing care that patients feel is genuinely supportive leads to higher satisfaction and loyalty.
So prevention, better outcomes, even cost savings. It seems like a win-win-win. Which brings us to the ethics of it all.
Precisely. Given the strength of the evidence, particularly around things like depression after a heart attack, it becomes an ethical imperative. The source quotes a powerful editorial from the Journal of the American Medical Association. Commenting on that 5-fold increase in death risk for depressed heart attack patients, it stated, "The clear demonstration that psychological factors like depression and social isolation distinguish the coronary heart disease patients at highest risk means it would be unethical not to start trying to treat these factors."
Unethical not to treat them. That's a strong stance.
It is, and it really encapsulates the core message here. Medical care that ignores or dismisses how people feel while they're battling illness is frankly no longer adequate. What is currently often the exception, this kind of emotionally attuned, relationship-centered care, really should become part of the mainstream standard of care.
So wrapping up, it seems the science is catching up to an intuitive truth. Our minds and bodies aren't separate, and how we feel deeply impacts our physical health. The challenge now is integrating that knowledge fully into how we practice medicine and how we live our lives.
Absolutely. It's about recognizing that attending to emotional well-being isn't just a nice-to-have, it's fundamental to health.
Which leads us to a final thought for you, our listener, drawn directly from the source material. It ends with this simple but profound statement: compassion is not mere hand-holding, it is good medicine. So perhaps reflect on that. Consider how incorporating emotional awareness, whether in your own life and how you support others or in what you expect from healthcare systems, can truly transform health outcomes. Maybe it even inspires you to advocate for or seek out more of this truly caring medicine.